Okay, we're back again. I am with Ashley Langford, Director of Clinical Excellence, and Caitlin Whitley, Senior Clinic Manager and Physical Therapist, and Mark Martire, Clinic Manager and Physical Therapist. We were just talking about vestibular dysfunction, and in between the sessions, we started thinking about just falls. So falls with the aging population, falls in general, and how there is a lot more community outreach for this, and we know that it's a deep financial burden when a fall occurs. And we just kind of wanted to dive into that, talk about maybe if it's worth it, any connection to vestibular, but really just the impact of falls with the aging population on our population. I know we all have a connection to somebody that is either at a higher risk of falling or has had a fall.
Yeah. I might even take that and say, how powerful is preventative medicine in outpatient rehab for this? If someone feels like maybe they're at that point where they're at risk with day-to-day life, we all tend to kind of hold off, we don't want to speak to it. What comes to mind with both of y'all?
I mean, I think the first thing that comes to mind with me is so many people think dizziness is normal. Feeling off balance is normal. They think, well, I'm just getting older. It's just a part of it. But it really is something that is very treatable and can be honed in and help prevent those falls and prevent all of those more major injuries that can occur because of a fall.
Yeah, I think that's important right there is the injury as a result of the fall, when you could be preventative from the beginning point of it and really, curb that risk for falling. Me personally, I like to go into the senior centers or the local community centers. We've set up free vestibular or free balance screens, I should say. And again, vestibular system may be involved, but it may not be involved. It might just be a balance dysfunction. And so typically what we'll do is we'll run them through a couple different balance tests. And then at the end, we have home exercise programs and we sit down with the person and go through what their results were and provide them something that they could just take with them. If they want to come in the clinic and get formal treatment, great. If they don't, that's fine too. But at least we're providing something that they can kind of work on in the meantime.
Adam, something I think is kind of cool too, like if someone is kind of dealing with this and they're thinking they might need some assistance, the exercises can actually be kind of fun. I mean, even when you're not in the clinic, right? They can be kind of like a fun, it's not your standard, intensive pushing yourself. You can go through some enjoyable type exercises to improve your balance.
Yeah, and I would make it as specific as possible. If they're a golfer, get the golf club in their hand. If they like to go out in the pool, do some pool aquatic type therapy. If they like to be in classes, they could join, the class at the senior center with other people or whatever it may be.
Is our falls becoming more common? Or is this just it's a topic that more people are talking about and therefore it is becoming more common?
I would say yes.
Yeah, I don't know which one's the chicken and which one's the egg, but I definitely think there's a little bit of both.
Yeah. We're aware of the burden, which, unfortunately, sometimes it's on the back end that we start, creating new laws or legislation that supports insurance and coverage. But yes, that is the good answer.
And is there anything that's inhibiting people from having access to screens or for people doing their exercises? Is it on me as somebody that has a aging parent maybe that I should be taking the initiative? It's more something that I should be aware of, or is it equally the responsibility of the aging individual as well as their support network around them? I don't know. That's just a very open-ended question, but what are some of the things that people should know if they're listening?
I think one big barrier is like fear. A lot of older adults, aging population that I work with is nervous is if I mention this to my kids, they're taking my keys away or I have to move out of my house. But if this is something that is addressed sooner rather than later, we don't even have to get to that point in the whole equation. So encouraging people who are struggling with things not to be fearful and not to think that this is going to go down some road where they lose their independence.
I think education too, educating primary care physicians is a big one. Making sure that they're looking at their patient's balance and that they know the services that we can provide to assist with this. I think that's probably one of the primary sources for our referrals into the clinic would be someone who sees their PCP and they get a referral for balance dysfunction or gait dysfunction. So I think that making sure that we're on top of educating really all aspects of it.
Yeah, Adam, the average person that's listening to this, the question would be, have you had a screen? I mean, that's awesome. Caitlin and Mark get out and they offer these screens, but the majority of people probably haven't had it. And if you haven't had it, then you're not aware of not only the results, but what we can see and offer someone. And the profession itself, I mean, physical therapy, occupational therapy, I mean, it's come a long way over the last couple of decades. It's exciting to see. And I hope that this is something that we can move further along so that more individuals can have access to being screened so that they are aware of what can they do to improve it. And yes, this is a problem.
Okay, and if I'm someone that wants to, I want my father, my mom to get screened, what's my first step as an individual looking to help them with this process?
I think either call a PT clinic and see if they have a specialist who can do that screen, somebody who has a little bit of vestibular training, or reaching out to your primary care physician and having them kind of guide that direction as well.
Yes, your physical therapist, your occupational therapist, they are all saints. So you get on the phone. We're fortunate because our company supports getting out and offering screens and access online. But I would say wherever you are, make friends with physical therapists and occupational therapists, and they'll support you.
All right, and then kind of before we close out, anything that's like anything that stands out to you about falls? Like, is this becoming something that is really important? Like, there are things that you hear on the news that it's an increasing awareness of certain things. Like, is there any trend, any research, any reason that this is kind of like something that people really should get out and become educated on?
Yeah, I mean, I think that falls are I don't know that they're more prevalent. Again, I think we're hearing more and more about it. We're seeing more patients from it, but I do think that we have a big chunk of the patient population in this country specifically that is getting older, and you got a lot more 60 to 70 plus year olds that are coming through that baby boomer generation, and I think just the recipe of probably not training this at all growing up and through the years. And then as you get older, these systems start to diminish a little bit. So you're seeing more falls, you're seeing more injuries from falls. Like Ashley commented before, you're seeing the financial burden from these falls. So how do we attack it? I think you do exactly what we're talking about. Let's get on the forefront of it versus just responding to the falls.
I also think from medicine in general, and I'm going to speak as a physical therapist myself, I think of how much we can do from a preventative perspective, like our ability to identify like causative factors versus treating the patient afterward. If you take a sprained ankle or shoulder pain, this individual might still be able to function. They can come in and get some physical therapy, or maybe it'll go away on their own. If you have a fall later in life, sometimes like it can be devastating enough to where as a society in medicine and rehab, like we have to treat it. And that goes back to the impact. This is an area that we hopefully recognize we have to be preventative. And I hope that goes down the road to other areas as well. So.
Oh, and something came to mind. I was thinking about when might be a good time also, because I think, so I'm in the Northeast and my in-laws travel to Florida and they live in Florida for the winter, and they live in a one level home in Florida, and they come home and then there's a loft that they have to climb a pretty steep flight of stairs inside their house to get to their bedroom. And it makes me think, when you spend 4 months, 5 months in one location and you don't train, they don't use a lot of steps or stairs in Florida. And then you come to the Northeast and everybody has a second level and you spend a lot of time now changing. So it's almost like those lifestyle changes, being aware of when something dramatic is changing in somebody's life, to be aware of that. And maybe that's a good time to jump in and say, okay, hey, we're going to go check the old system, check the old balance, get everything looked at, and before you start climbing stairs or coming downstairs, more importantly, I guess.
Yeah, I agree. I mean, it's a strength issue too, right? So if you're consistently doing the same thing over and over again on a level playing field, and then you introduce something like that, it's a whole shock to the system. So you're right. Training it all, I think, at that point in time would obviously be a huge plus.
Okay, so the take homes here are prevention and education, or I guess that's kind of two ways of saying the same thing, but that's kind of like our prime takeaway on falls, right? It's really making sure that people are doing the due diligence, both the support network, but also the individuals, to get screened, to be educated, and know, just like anything else, right? It's not just a one and done. You're not just gonna check for falls and I'm fine and then I'm good. It's something we have to kind of do repetitively, maybe semi-annually.
Absolutely. Absolutely. Get online. The physical therapy, occupational therapy profession, there's pretty easy access to identify how you can get in touch with them and figure out how to get a screen.
Awesome. Okay, final words, anyone?
Now
Excellent.
work on that balance.
Work on your balance. All right, life balance. All right, Ashley, Caitlin, Mark, thank you very much. That's the end of the session.